Hello, everybody. It's Tuesday at 1 o'clock Eastern Time. Welcome to the weekly webinar for all things BlueStar TeleHealth and RPM and CCM and other things like that that you want to talk about. I'm Rob Ray. I'm the CEO of BlueStar. And as usual, this will be a quick 20 or 25 minutes. We'll keep it to half an hour and then we'll post it on the web later on. Just got off the call 15 minutes ago with an FQHC out in Indiana that was brought to us by one of our fine reps. And she introduced us to the COO and to one of the other folks there. And so it looks like, from what I can tell, they'll sign a letter of intent with us to move forward. And just so that you know what we're doing with FQHCs, federally qualified health centers, a lot of them have, they're getting grants from HRSA and from other sources to do remote patient monitoring, and they're looking for people to help them. And so it's hard for us to walk in with a straightforward pitch because every FQHC is using different ways to fund their RPM programs. Some are paying for it with in-house funds. Some are getting a grant and then another grant and then another grant. Some are using a grant to pay up front, and then they're using CCM CPT codes, chronic condition monitoring CPT codes, to keep it going. And they're sort of doing RPM under a CCM reimbursement model. And then some of them, we've had one that said, look, I'm going to spend money up front with a grant, but then I want somebody else to do fee for service, taking care of the patients thereafter. So what BlueStar is doing is, because it's too complicated, it's not like we're saying, here's a pen, we're selling it to you for 39 cents. We're signing a letter of intent in which we agree to work together to come up with a viable program. And hopefully at the end of that, they'll sign a contract with us for the viable program, because we can't do any pricing or costing when we don't know exactly what the program is and when they don't know how it's going to be funded. So by signing this letter of intent, we're essentially becoming an unpaid consultant, but we're changing that healthcare center from a prospect to a client. It's an unpaid client. And then we'll spend a few weeks coming up with a game plan for them. And hopefully at the end of that, they'll like us and they'll trust us and they'll understand the program. And then hopefully they'll sign a deal. So I know that the rep who just brought us into that, it was our first call, and it was a good one. And so we look forward to working with them. And they said, oh, we have to, our grant is for 300 people, but we have to have 200 of them on by Christmas. And we assured them that that would be no problem whatsoever. BlueStar onboarded 300 people in 1 month, last fall. Okay, so that's FQHC. A reminder that in June, if any of you have presentations for us like that, we are happy to send a Health Heroes gift package to those folks that had the presentation with us. And they can put it out in the lunchroom, and the staff can nosh on $100 worth of goodies that are provided by another veteran-owned company. We're not in the gift basket business, but we know a veteran-owned company that is. And so $100 Health Heroes gift basket will be sent to any entity that gets on the phone with me for 15 minutes. So when you're out there knocking on doors with people, say, hey, if you talk to that old Admiral Ray in June for 15 minutes, he'll send $100 worth of snacks to your team. And if that's the straw that breaks your particular camel's back, then let's do that. What I wanted to do today was to take you through a brief presentation that we're starting to use. What I found was that we have a 4 or 5 page presentation. You know, it talks about why telehealth is good and what RPM is and why VitalTech is so cool and that's the best software, and why BlueStar can be your provider partner. But what I'm finding now oftentimes is when I'm on a webinar or on a Zoom with somebody, I need words that I can put up there that are simple and straightforward. And so we're starting to use this new PowerPoint. And now I'm actually getting to the point where I send it to people in advance of the meeting and asking them to read it. So I'm going to take you through it. It takes about 20 minutes when I'm doing it with a client, because you folks all know RPM and know BlueStar, and you're an exceptionally good looking and articulate and intelligent group, as I can tell by looking at you on my Zoom participant list. I'm not going to go through all the details, but it'll give you a sense of it. And if this is useful to you, then feel free to use it. Okay. So without further ado, I'm going to share screen and go to our basic Zoom presentation. Okay. And then I bellow into the distance and I say, Pat, can you see that okay? Okay. That's our technical, Pat is somewhere in the background. I'm not really sure. He's either over my left or my right shoulder. So this is a quickie presentation that I do, but I send it to people in advance because it goes soup to nuts through the entire program. Okay. You know, why have RPM, about BlueStar, services, process equipment, EMRs, FAQ, yada, yada, yada. We have RPM because most seniors have chronic conditions, and chronic conditions are bad, and RPM can improve outcomes. And the CMS healthcare system has said, hey, it's worth spending $1,000 a year to manage these chronic conditions because it's better for the patients and it's better for the system. It reduces cost. And that most practices outsource RPM, and that's why we're having this conversation today. BlueStar, you guys know the stuff about BlueStar. We're good guys, and we're credible, and we're military and veterans and award winning and all that other stuff. Okay. And then sometimes, depending on who we're talking to, I put this team slide in there because we, you know, if we're talking to people that were Army, Navy, or Air Force, and we're talking about our veteran status, then I talk about this. By the way, if you have any questions, type them into the question box and we will get to them at the end of this brief presentation. So always like to get questions. And here where I say, here are the services. I go, remote patient monitoring is really what we're talking about today. And it comes in 3 buckets: equipment, software, and monitoring. But really, when you break down an RPM program, it has 17 functions, 17 things there on the right. And BlueStar can do all 17, or it can do just some of the 17, and your organization can do the rest. And we'll plan that out together. And then I say, here's the RPM process. You enroll patients, you activate them, where you program and kit and ship and label and send everything out and get the data flowing. And then 3 is the system, which is the hardware and the software and the comms and the engagement with the patient. 4 is monitoring, where we're monitoring the data and interfacing with the clinical providers and with the patients. And 5 is follow-up. Follow-up has 2 parts. If the patient needs clinical care or attention, there's medical follow-up, and then there's administrative follow-up to make the billing occur correctly. Here's my equipment slide. There is equipment. There are a few peripherals, and they talk via Bluetooth to a HIPAA-compliant tablet. And that tablet then talks to the cloud. And once the data is in the cloud, we can send it to the patient's family through their cell phones, or we can send it to our monitoring team, or we can send it directly to the clinical provider. And that hub in the home, we think the best hub is a tablet, but we can also use a smartphone, and we're actually working on a smart TV hub also. The software is very cool. We use VitalCare, which is from a company called VitalTech, and it has a bunch of capabilities, as you can see on the right. In addition to that, when needed by the customer, BlueStar can take data out of VitalCare and then send it to the customer for customized alerts or notifications or analysis if they see fit. And then I typically mention a couple of things about VitalCare, but then I go to the next slide. Here's the tablet view. When your patient turns on their tablet, they'll see this. And then when they press that VitalCare button, they'll see this. And you can see that there are tiles on the right, and one of the tiles is vitals. And they can also make video calls and do medication. And when you press the vitals button, they see this. On the clinical side, we're just showing you little pieces of the software to be HIPAA compliant. There's a population overview where you can see all the patients and all their status and all the things that are going on. You can see alerts of which patients need to be taken care of. You can see details on any one given patient. You can look at their graph of data. All of this can be put into a report at the end of the month that shows you all the patient data and the notes and the graphs, and it can be appended into the EMR. That's the end of my software presentation. People always ask about connection to the EMR, and my answer is we can connect with any EMR to any extent you desire. And there's a spectrum of connection that ranges from none to manual programmed all the way up to automated. And we typically encourage people to get the program going and don't worry about automatic connection to the EMR until required. Monitoring and engagement is key. If you don't have engagement and compliance, you don't get reimbursements, and therefore you'll have no program. The monitoring team is an American team led by nurses, and it will do things according with your protocol as you specify. We talk about that some more. Billing support, we generate lots of data to help you bill. We have an audit-proof data trail. We can show it all in an authoritative database, which is the software. And we're actually starting to offer the option of BlueStar handling billing if people don't want to do the billing themselves. We talk a little bit about reimbursements just so that people understand that there are CPT codes for reimbursements. I don't spend a lot of time on this slide. This shows our prices. I show simple reimbursement calculations. If I'm talking to someone that does fee for service, and this shows how much money they make per month, per patient, if they do RPM only, or if they do some telehealth, or if they do active telehealth. And then at the bottom, it says, yeah, and if you have 100 patients and you do nothing but let BlueStar do RPM, you'll make $36,000 a year. If you have active telehealth, you'll make $126,000 per year. And we'll talk about this. Here's the financial summary for people that don't like spreadsheet looking things. And it's the same concept, just RPM, RPM plus telehealth, RPM plus active telehealth. And this typically gets the conversation going. And if that didn't do it, then I say basically think $30 per patient per month is just straight RPM, but you can make more by doing telehealth, by adding chronic condition management, or by insourcing a portion of our full service suite. FQHCs have different financing. So if I'm talking to an FQHC, I hide the previous slides. If I'm talking to a fee-for-service biller, I hide this FQHC slide, because FQHCs are not classic fee-for-service the way most physicians' practices are. And so I have this slide in there for them saying, here's your options. And then FAQ, I talk about financial obligation, how there is none. There is absolutely zero risk. There's no ongoing contract. There's no upfront investment. We talk about paperwork required to start. We talk about the onboarding process, alternative equipment, program management. And then I say, and here's why you should think about using BlueStar. We've been in this business for 7 years. We have thousands of patients across the country. We're flexible and customizable. We're the right size. We're not too big. We're not too small. We talk about the military thing. And then our way forward is this non-binding letter of intent, which we recently modified to make it be very simple and very, very straightforward. And it basically says, hey, let's work together to come up with a game plan. And that's it. So that takes about 20 minutes. And we have found good success with this. We've used it on a half dozen places. It seems to answer most of their questions. It's not fancy PowerPoint, as you can see. It's intended for someone to be able to read while I'm talking to them, and also to be willing to read it before we send it to them. So it doesn't win the PowerPoint of the Year award, but in terms of simple, straightforward communication, it seems to have been doing the work okay. So before I go back, let's look at questions. Someone said, are we going to have access to this presentation you showed today? And the answer is absolutely yes. Okay, we'll send it to you. And then here's another question. What differentiates BlueStar versus the competition? First of all, I almost never have someone say, oh, well, here's a competitor. Why are you better than them? So in many of the cases, the competition is not another RPM provider. It's doing nothing. When someone says what differentiates you from the competition, I try to tailor my answer, but I would say, number one, we are full service. We do all 17 things. And a lot of firms don't do that. A lot of firms only do some of those 17 things. Number two, we're flexible. We don't have to do all 17 things. We can do 13 or 15 or 11. In other words, we customize a plan that meets your needs. We're not trying to stick a square peg into a round hole. We're not forcing you to do things our way. Number three, we're credible. We've been doing this for a long time. We have thousands of customers. We have 20,000 patient years of putting equipment into the homes of little old ladies and making it work. And that's effectively what RPM is right now. And so we have lots of experience and we're credible. And we have, that's when I talk about the military sense of mission and our management team, and we've been there and done that. So, and then lastly, we are hardware agnostic. We're not selling a software. We're not selling a hardware. We're providing a service, and we will build that service that meets the needs of your individual needs. So with this Merrim Health in Indiana, who I just talked to less than an hour ago, they had already received an RPM presentation from somebody in Chicago. And I don't know what that presentation was about or what those people pitched. But at the end of the conversation with us, their COO said, I like your game plan and your method, so send me the letter of intent. Someday we will come head to head against other RPM providers, but it hardly ever happens. I can't think of a single instance in which I've had a customer say, well, how do you compare to XYZ? And I'm happy to, if someone said, do an analysis of how you stand up to XYZ, we'll give them that analysis. But most of the time that hasn't been an issue. So I hope that answers that question. I'm going to keep pressing on. Check the revenue slide. I believe the comma is in the wrong place in the annual potential incomes. Okay, let me go look at that revenue slide real quick. First, I have to get this thing to go away. Okay, those all look right. And this is all right. In other words, if you have 1,000 patients and you're doing RPM plus active telehealth on those patients, you'll make $1 million a year in profit. Notice that this $1 million a year is 1,000 times this $1,263 a year. Okay, so those are in the right place. And so were those. Okay. All right. I appreciate you guys asking all these questions. What are you saying now? Do we have this writing somewhere about BlueStar in regards to what we can do versus competition? I guess I will. We have a one-pager about BlueStar versus the competition, and I will put that up on the website if it isn't already there. So I have two due outs. One, I'm going to send everybody this presentation, and then I'm going to send everybody our one pager on us versus the competition. Okay. All right. So we're getting to the end of our half hour. And as you know, I have a short attention span, so I try to keep things to half an hour when we can. I'm going to stop screen sharing, and I'm going to ask if there's any other questions. Oh, here's a couple questions that somebody snuck in the chat section instead of the question section. Oh, Rick Warren, who is a very, very smart man, who I told him yesterday he looks like Ernest Hemingway in a good way, says that RPM frees hospital beds for elective procedures. And then someone said, what is the HQ-HTC type of clinic you were mentioning? I'm sorry, FQHC, Federally Qualified Health Center. They are typically clinics that are servicing low income and disadvantaged populations using federal dollars. Oftentimes, many of their folks are on Medicaid, which, as you know, Medicaid is essentially for low income people, and Medicare is for people over the age of 65 in general. And then a dual eligible is someone who is eligible for both Medicare and Medicaid. And so in FQHC, the federal government gives grants to them, and there are about 500 FQHCs that received a grant at the end of last year for hypertension management. The federal government said, here's some money, find people that have high blood pressure and monitor them from a distance. In other words, do remote patient monitoring to help with their hypertension. And the government put out about $100 million in grants to those 500 organizations. So we're currently talking to about 5 of those 500 organizations, helping them to spend that grant money. So if you are out there on this webinar and are not familiar with what I'm talking about, type in HRSA, HRSA, HRSA grants for hypertension, and you'll see an explanation of the program, and it actually lists all the people in the country that got the grants and how much they got. And if that doesn't make sense to you, then get a hold of Alan or email me, and I'll forward the email to Alan in our office, and we'll get you set up. Okay? So I think I've got, do I have all my questions answered? And I have my chats answered? Yes, I do. Okay, and we're at 1:26. So remember, here's our pitch. Are you ready? You go to someone who has patients. Someone can be a small hospital. It can be a physician's practice. It can be an FQHC, which is a federally qualified health center, which is like a community center. And you say, do you have patients? And they go, yes. Then here's your question. Do you have a remote patient monitoring program? Are you doing RPM? That's question 1. If they say yes, then say, how's it going? Because we do deal with folks that have existing RPM programs that aren't working very well, and we help them fix it. If they say no, they say RPM is good for your patients and it can be good for your organization. Would you like to spend 15 minutes talking to an admiral I know about whether RPM would be a good fit for you? Oh, and by the way, if you do, we'll give $100 worth of goodies to your staff because they're having a Health Hero special in June. That's it. Do you have patients? Do you do RPM? If yes, how's it going? If no, say, would you be happy? Would you be ready to spend 15 minutes talking to an admiral? And I don't want to oversimplify, because I've been a salesperson and I hate it when people oversimplify, but that's the pitch, gang. And so go give that pitch, and some certain number of people will want to talk with me. And then when they talk with me, some of them will be interested in trying the program. Okay. If it were more complicated, I would give you the more complicated stuff. As usual, everything that we're talking about today is going to be up on the website, BlueStarTelehealth.com/sales. Go there. Please look at the handouts. Please look at the presentations. I'll get this new, simpler presentation up there. Just peruse, watch the webinars, and then go out and knock on some doors. And the reps that are knocking on doors are getting pitches, and the ones that are getting pitches are getting LOI signed. And we've signed 3 of them in the past 10 days, all through reps that I think did essentially what I just said to do, but perhaps in a more elegant way. Okay. All right. Thanks for your time, gang. Good to see you. I'll talk to you again on Friday with the weekend update, and then we'll see you next Tuesday, same bat time, same bat channel. All right. See ya. Bye.